undergoing a surgery. So we do the stoma marking earlier. We will mark you ileostomy and colostomy both, because whatever is required on table, let them decide. Okay, we'll check your rector sheet. So can you bend your head forward a little bit, and have cough a bit, louder. So this is your rector sheet, and now can you put the head down? Doing a ileostomy marking, which is normally, all the ileostomy is normally marked on the right lower quadrant. So we make one small line straight from umbilicus to simplex pubis, and one lateral from the umbilicus to the sideways, and then we make a triangle. We check the superior iliac crest and then draw one line from there to the superior iliac. This is a triangle we talk about always when the ileostomy marking is done. Now we have to take 1/3 and 2/3. This is the normally suture line which will come. So we have to be away from suture line. We just put 3 and 4 fingers from here. So this gives us a 1/3 and 2/3, and we come in between and we put one mark here. We will do multiple marking first and then counter check which is a conform one, because when you are marking it, we have to have many issues which we have to look into. We have to see whether it's at the proper distance from the umbilicus and there are no folds and all. At the moment you see the abdomen is very flat, but when we make the patient sit up, can you please sit up? Fine, and just bend forward. Can you see this mark which turn to the side? Yeah, it's still not under it. Here, can you please stand up? Can you bend forward? Bend straight, right. See, I can see one fold here. There may be one fold here because once the suture comes, but this is a correct as per. Can you turn the sideways? Right, that's it, correct. Now this is a appropriate marking. Can you sit up? We have done 3 different or 4 marking we do, but only one which is the fit for you. Okay, so this is the correct marking. Just clean your rest of the marks. Okay, I'm just going to put one tape. I have cut the tape as the shape of round because stoma is round. So that this, please don't remove this. Okay, surgeon will know from this कि here they have to make the stoma. I'll mark a colostomy also. Now colostomy is always on the left side. Only ileostomy also is as it is on the right side, but sometimes you will see ileostomy on the left side also when there is not the proper place to make a stoma on the right side, or some previous surgeries patient had where the ileostomy has to be taken on left side. The marking is the same way whether it's a colostomy or ileostomy, but the side changes. We will check the rector sheet. Can you put up the head? And this is a nice and strong rector sheet. A marking is normally done within the rector sheet. So now again we are going to mark the same way, sideways, and this straight imaginary line is already there, right? And then go to the superior iliac crest and do the marking. To again 2/3, 1/3. So we will see one is this side it comes, then another is here, and I will take one more here because in case this will be provisionally only. Now again we have to make him sit and all. We can see the bottom both are out of reach. A top one I'll avoid it only in case, because again when he gets operated he may get one fold here. We will see. Can you bend? Right. So this is again this would be the better side for you. In case the patient is going to have 2 stomas like ileostomy and urostomy or colostomy and urostomy, in those, see, this is coming on the same level, but when it is like that we don't put them on the same level. We normally put them one higher and another one lower. Reason is when the patient requires a belt, it should not cross, but even without that. So it's a question is which one we put a higher. Now higher would preferably, I'll prefer it as a urostomy. So we will put this little higher, but as we are only doing, so I'm going to put 2 marking here in case they are making 2, like sometime even mucus fistula is made. So in those cases mucus fistula is not so much marking is needed, but still they can make it a little different so that the belt does not come over it. Now I am going to remove the rest of the excess marking. Okay, we will put the tape so that we confirm, but then if you make 2 marking, you have to put it which is the first preference and which is the second preference. This is my first choice, of course, and the second choice what I am going to do is little higher up. So I'll put 1 on this, okay, and 2 on this.